Actually, very good. Great. Thank you.
Thank you for holding the hearing. And Mark, thank you for being here. I first of all want to say that I think during the COVID-19 period, your people haven't gotten the credit they deserve to be able to keep our transportation system working well. And having traveled a lot on airplanes in the last couple months, I can say that people are back. You know, the airports are not entirely full again, but planes, instead of being 10% and instead of being 25%, are now 80% full that I've been on. And the people you have who are putting their own health at risk every day are to be commended. And I thank you for that. And please pass along our gratitude for all of those individuals for helping to protect all Americans as we try to get this economy back going again in the midst of continued concerns about COVID. One question I have for you, you know, I've talked to your people, I've talked to them about the importance of the masks and the hand sanitizer and the gloves and so on. What has the incidence of COVID been among your people that you can attribute to infections that are resulting from interaction with passengers? Have you had an issue there?
So that's a hard one to quantify, but overall I would say yes, clearly. And if you look at as well, the epicenter for us at CBP, it's kind of mirrored what's happened in the United States. So our first largest degree of COVID-related outbreak for our personnel happened in New York a few weeks ago. And now, as expected, as we're starting to get additional outbreaks in Texas and Arizona and California, the trend for CBP personnel is following that. What is hard to determine sometimes is whether they got that from community spread outside of work or they got that while at work. But again, I know I'm saying the obvious here. As you said, they're out there every day, especially right now on the southwest border. They're having to, you know, not everybody is giving up down there. A lot of these folks are running from them. They're having to go down and get up close and have close contact, high-risk contact that we could call it. So they're definitely exposed. We've had several hundred that have tested positive.
Mm-hmm. Yeah, well, thanks for helping to keep Americans safe and also to keep your people safe. On the kids, I think about 22,000 unaccompanied UACs, kids have come in. And as you know, we've done a lot of work on this issue in the permanent subcommittee on investigations and some of the poor interagency communication between HHS, DHS. My sense is some of that is better. I want to hear from you on that. But my general point would be, I'm pleased to hear that you continue to do the screenings on trafficking. None of us want to see these kids trafficked, and it is in the COVID era a different situation. I know you have to return some people because of the fear of the COVID being spread, but I want you to know that I appreciate your personal commitment to continuing the screening for trafficking.
And so if I could real quick, so if we go back to May of this time last year, we were averaging about 370 children a day. Now it's 31. That is just tremendous. And so those children that under Title 42 that we do return, we are intensely working with the government that we're returning to make sure that they are returned in a safe, humane, compassionate manner, and to make sure that those countries that we're returning to are working to return them with their families. I mean, this process actually that's what we're trying to do. We're actually trying to reunite the children with their families back in their home country.
Well, and that's exactly what we should be doing. You know, as you know, I got involved with this egg farm issue in Marion, Ohio, my home state, where you had kids actually returned to the traffickers by HHS. My sense is that the reforms have been put in place to help on that.
Yes.
With regard to Customs and Border Protection and the fentanyl issue, you didn't mention the STOP Act earlier, and this committee, as you know, passed the STOP Act. We got it through Congress, and what it did was it required the Postal Service for the first time to require this advanced electronic data so that your people can identify the packages coming from China and elsewhere that might have fentanyl in them. And we required 100% from China, by the way, for good reason. Can you give us a report on that? My sense is we're not quite at 100%. We were at 86% as of last year. And my sense is that this has been very successful. Already, the FedExes and the DHSs, the other private carriers, had to provide this data. You all were in their distribution centers. You were finding the contraband. Now you're doing it with the post office. As a result, the traffickers have shifted their means of entry into the United States, and more of it's coming across the border now instead of through the mail. But can you give us a sense of how you've been working with the Postal Service in particular, and whether you think that's working well, whether the STOP Act needs to be improved, or whether you think it's actually effective at stopping this fentanyl that was coming almost entirely through the mail at one point, and then primarily through the mail?
So I don't know. I'll have to get back to you, sir, on the exact stats of the percentage we're at right now, but we can get back to you on that. But the work with CBP and the Postal Service, it is a great relationship. It's a great partnership. We have been working together for a very long time. I think I mentioned a couple of times the Operation Megaflex that we've done, and because of that work, we've actually went out to the corporate world, and we put a statement out there saying, hey, we need some folks to come up with innovative ideas on how we can get better at detecting drugs in the mail environment.
Right.
And that's being worked on right now. So we're continuing to do things to improve our ability to do that. But you're spot on. And like I said earlier, we attacked that together, kind of a USG perspective, and we saw a dramatic increase, especially coming from China. But as you said, unfortunately, they're just shipping it now directly to Mexico, and it's coming across the land border.
Yeah. And by the way, the best thing we can do to help you is stuff like the STOP Act, which required the post office to do what they refused to do. The Interdict Act also provided funding for some of this technology to be able to help you do your job. So let us know where we can be helpful. I think the place we can be most helpful right now, frankly, is on the prevention, treatment, and recovery side to try to reduce that demand that drives so much of this with these huge profits you talked about earlier. And we were making great progress there with regard to opioids. As you know, in the 3 years before COVID hit, we finally had reductions for the first time ever in any way you measure it, including the number of overdoses and overdose deaths. Now I think we're back up again, unfortunately. At least in my home state of Ohio, we're seeing more overdose deaths in some cities than we had last year or the year before, getting back to our high level of 2017. So we got to do a better job to help you to reduce that demand, because otherwise you have an impossible job. Very much the same as we were talking about the importance of the E-Verify system in immigration, that magnet of jobs, whether it's the magnet of the demand for drugs here or the magnet for jobs. On E-Verify quickly, our big issue has been the identifier. So the E-Verify system, in my view, ought to be mandatory. I think Senator Romney spoke well about that. I agree with him, but the issue is these employers who say, yeah, I accept that the ID, which was a social security card and a driver's license that were issued in my state and seemed valid, but they're fraudulent. And it's been difficult for us to figure out a way without a national identifier to be able to assure that the person is, in fact, someone who should be in this country and is here legally. What are your thoughts about fraudulent documents and identifiers and how we can address that issue, which is really the bottleneck in having an effective E-Verify system?
Well, what I'd say, so as you know, it's a little, E-Verify is outside of CBP. It really is in ICE's purview, but so I want to be cautious not speak on behalf of Director Alberts for ICE, but it's a challenge.
That, but it affects your guys and women as they're trying to do their job, unless we can deal with the demand again in this magnet. So I hope, what if you could weigh in a little bit this morning, and then my time has expired, but also just stay engaged in this issue, because you're telling them this helps us to be able to do our job, I think, may be effective in getting us to a better system.
Yes, sir. And we have those discussions all the time. So even though it's outside my purview, trust me, I'm on board.
Yeah,
we have to get better at holding those companies that are intentionally hiring illegal workers. We have to hold them accountable. But it's a complicated, tough matter to investigate.
Yeah, I will say there's some new technology, facial recognition technology that people are talking about, because again, you can't rely on these documents, many of which are fraudulent. You can buy a Social Security card apparently for $25 on the street that's fraudulent, but effective sometimes for those purposes. So thank you again. Thank you to people. Tell them that we appreciate what they're doing every day.
Thank you. I will.